Hi there. So as you may know, we focus a lot on hormone levels and healthy hormone levels at our clinic. And lately I have actually been doing additional research on PCOS, Polycystic Ovarian Syndrome, and endometriosis for a dissertation that I'm writing for my master's in human nutrition and functional medicine. And I wanted to try to summarize in just a couple moments here what I have been reading about today, because I think it's fascinating and I want to try to find a way to write an article about it. But in the meantime, I think a video is kind of nice just in case anyone's looking for a little bit more information. So the first thing to notice is that with polycystic ovarian syndrome, we often see cysts on women's ovaries. We see increased androgens or testosterone levels. We see insulin resistance. And you really often have two out of the three. But in addition, there have been quite a few studies that have linked gut dysbiosis or leaky gut to polycystic ovarian syndrome. And I think it's really interesting to notice that one of the studies actually measured zonulin. Zonulin is a protein that goes up when we have gaps in the small intestine or something called leaky gut. So the higher the zonulin level, the worse the leaky gut is. Now, why does leaky gut occur? Things like stress cause leaky gut, antibiotics cause leaky gut, birth control pills, poor diet, antibiotics even just in our water supply, so you don't have to actually take them yourself, and then low hydrochloric acid. Those are just some of the major things that cause leaky gut. Caffeine can also cause leaky gut. And so what happens when you have leaky gut is that the immune system is activated because you now have enteronegative, you have gram-negative bacteria that actually get from the inside of the gut through the gut into the bloodstream, and they're not supposed to. And they produce something called lipopolysaccharides. So if you're Googling things and you look for LPS, that means lipopolysaccharides, and PCOS, which is polycystic ovarian syndrome, you can find quite a few articles. And what this means is that the bad bacteria that are in the gut that should not be getting through the lining of the gut and the bloodstream, they make it into the bloodstream, and then the immune system attacks. And when the immune system attacks and does this chronically over many months and sometimes many, many years or even decades by the time I see someone with PCOS, we have insulin receptor dysfunction. So the immune system is actually causing the insulin receptors to not work anymore, which, as we know, causes type 2 diabetes. But before you get to type 2 diabetes, you just have an increased insulin level in the blood because the insulin can't get inside the cell anymore. And what happens when you have an increased insulin level in the blood is that you also have an increase in testosterone. And when women have an increase in testosterone, they don't ovulate anymore. So the whole thing started from leaky gut and ended up causing no ovulation or infertility or polycystic ovarian syndrome. Now notice that a lot of women actually have findings of polycystic ovarian syndrome. They have an increased LH to FSH ratio on their labs for a very long time before they have a cyst, or they have very mild cysts that they don't feel. So you can have polycystic ovarian syndrome when I check your blood work that actually has been there for a really long time and nobody else has noticed it or diagnosed you with it. These things don't happen overnight. They happen over many, many years. Our goal is always to catch something closer to the beginning so that we can quickly fix what caused it. So anything you can do to heal leaky gut is going to help heal polycystic ovarian syndrome. And if you're having infertility and you're having a hard time getting pregnant, addressing leaky gut is always a good idea. The last thing I just want to say about that is that the study that looked at zonulin, which again, zonulin goes up when leaky gut goes up. So zonulin is not a good thing. The more zonulin you have, the worse leaky gut you have. The higher the zonulin levels in these women in this study, the less menstrual cycles they had every year. And so they weren't actually ovulating and they weren't getting a period because their leaky gut was so severe. We also know that women and men likely have very different microbiota, so different good bacteria after puberty. So when women start to shift more towards a male microbiota, then they have higher testosterone and they have less periods. and less likely chance of getting pregnant or more likely chance of having polycystic ovarian syndrome. When men actually, when their flora shifts more towards a woman's flora, what then happens is that they have symptoms of low testosterone, things like ED or ADHD symptoms, really low motivation, inability to finish tasks that they start. So I see tons of people in the clinic, men that have low testosterone, and it's probably been that way for a very long time. I also see a lot of women that have polycystic ovarian syndrome, and it's probably been that way a long time. So I just wanted to give you guys a heads up that the gut is the key. We're always trying to heal the gut for lots of reasons. And I hope to also, we're going to start a much longer blog than the one we have and publish some of these articles. Thanks.